present this important data on renal outcomes or the DAR guidelines from theory to practice, and I'll be having a closer look at patients with chronic kidney disease. With regard to this presentation, I don't have any disclosures, and I'd like to start by commenting on the type of studies that we usually see in patients with chronic kidney disease in Ramadan. And before that, I'd like to mention that we would worry in patients with chronic kidney disease, would worry about specific things. The first is dehydration. When patients fast for a long period of time, they might become dehydrated, and that dehydration might affect their kidney function. With dehydration, some patients might develop hypotension, and with dehydration and high blood glucose, the risk of thrombosis is also high, and some patients might develop acute kidney injury. The other factors that we look for in patients with diabetes as risks of fasting are basically the hypoglycemia and the hyperglycemia, or even ketosis and diabetic ketoacidosis. So these are basically the risks of fasting in patients with diabetes and chronic kidney disease. So a lot of these studies has been done to look into the risk in this group of patients, and I can divide the studies into two different types. The first are the studies that were done to assess the renal function in patients with chronic kidney disease, and to look at the studies that assess the renal outcomes as well as diabetes outcomes in patients with diabetes and chronic kidney disease. And if we would have a closer look at these studies that assess the renal function, this has been presented many times. There is not much of new studies recently on this group of studies, and it has been summarized in the guidelines as follows. They put, actually, we put the studies that were associated with worsening of kidney function during Ramadan, and there is another group of studies that showed an improvement in kidney function during Ramadan. If you can see here, there are around 4 major trials that looked at renal outcomes in patients with chronic kidney disease, and few of the patients included in these studies were basically having diabetes. And in most of the studies, like the one by Al-Wakil et al. That was published in 2007, and the most recent by Bashier et al. In 2017, all these trials has shown that fasting during the month of Ramadan for a patient with chronic kidney disease is associated with worsening of kidney function. And on the other hand, the studies that looked or that showed an improvement in kidney function were also small trials. The first one was Bernier et al. In 2010, and the latest again by Al-Wakil et al. In 2014. And again, I will remind you, these were basically studies in patients with chronic kidney disease, mostly non-diabetic, and very few patients included in these trials were having diabetes. Now, the issue with these medications, the issue with these trials, is that they are small trials, and in the guidelines, when we put the conclusions and the recommendations in the DAR guidelines, we thought that the studies are really small. However, we need to put patients with chronic kidney disease as high risk and very high risk, and we should discourage them from fasting. And as I said, all these studies were actually, patients were recruited in these studies, they followed the best practices, which is not the usual practice that we do for all our patients during the month of Ramadan. Those patients mostly received advices. They have been followed closely during Ramadan and after Ramadan. And the other issues with these trials were that the first thing is that these trials were actually very small trials, and each trial included around 20 to maximum 60 patients only. So the conclusions from different trials were very inconsistent. Some trials showed improvement, other trials showed deterioration in kidney function. The second issue with these trials is that in each trial, it includes not only a single stage of chronic kidney disease. Some of the trials has included patients with stage 2, stage 3, stage 4, and stage 5. And the number is small. So when you divide, you find the number of patients with stage 3, for example, only 5 or 6 patients. And then at the end, the authors will draw conclusions from these small numbers. The third issue with these trials is that all the trials done in the month of Ramadan were basically non-randomized and observational. And the other fact is that many of the trials has been conducted in high-income countries, mostly in the Gulf region, where fasting is different than fasting from other countries where the income is low. Even the medications used in this class or group of patients are different from other countries. And the last and most important is the randomization bias. Whenever we find a controlled trial, the trial will be the groups will be either a fasting group and a non-fasting group. And if you look at the fasting and non-fasting group, these are not randomized. Those who are not fasting are the patients who themselves opted to not fast during the month of Ramadan because they know that their conditions will not allow them to fast. So they're basically higher risk than those who usually fast during the month of Ramadan. And that results in when people who know that they have good health and they fast, then likely the outcomes in those patients will be better than those who opted not to fast. Now, since the guidelines has been published, there is one trial, only one trial that was published in end of 2018, and that looked at the hydration status in patients with chronic kidney disease, and they included patients from stage 2 till stage 4. So it included stage 2, stage 3, and stage 4 patients. And as I mentioned earlier, the study was controlled trial where we had 2 groups. The first group are the people who opted to fast during the month of Ramadan, and the second group are the people who opted not to fast during the month of Ramadan. The authors in this trial, they tried to look for the effect of Ramadan fasting on the hydration status. And they tried to assess the hydration status by assessing the kidney function, by checking the urea, the creatinine, as well as the pro-BNP level in those patients. So they checked these parameters before Ramadan, like a week before Ramadan, and then in the 3rd week of Ramadan, and within 4 weeks after the month of Ramadan. What is interesting in this trial is that this is probably the first trial that uses the pro-BNP as a marker of dehydration, and it is the first trial that checks the kidney function within the month of Ramadan. All the previous trials checked the creatinine and the urea before Ramadan and after Ramadan, but this is the first one that checked the creatinine and urea within the month of Ramadan. So what were the results in this trial? The authors found that the levels of urea and creatinine has actually increased in the 3rd week of Ramadan, and then it has improved. That was a significant increase during the 3rd week of Ramadan, and then it improved 4 weeks later after Ramadan. The pro-BNP levels has dropped significantly, indicating a form of dehydration, and that has improved later after the month of Ramadan. And then with these results, the authors has concluded that patients with the stage 2, 3, and 4 can fast throughout the month of Ramadan with no significant deterioration or mild deterioration during the month of Ramadan that improves usually after the end of the trial. So what about the other type of trials? These are the trials that assess the renal outcomes in patients with diabetes and chronic kidney disease. And I'd like to go back to two major trials. That there are actually three trials that were conducted. The latest, which was not included in the guideline, has been published in 2021 by Cartas et al. And they looked at patients with stage 3 and 4 chronic kidney disease. All patients were diabetic, and they excluded patients who had an advanced heart failure, acute infections. Patients using insulin were actually excluded in this trial. And this is something important to mention. Most of the patients with chronic kidney disease and patients from low-income countries, when they reach stage 3 and 4 chronic kidney disease, are actually on insulin. And in this trial, patients with diabetes on insulin have been excluded. So what did this trial do? The trial included around 130 patients. They divided patients into two groups: those patients who opted not to fast during the month of Ramadan and those who fasted during Ramadan. And I'd like to mention something very important here. If you look at the mean creatinine before in the group who did not fast, and when we compare it to the group who fasted, those who were not fasting during the month of Ramadan actually had a higher creatinine compared to those who fasted during Ramadan. And that proves exactly what I mentioned earlier. People who opt not to fast during the month of Ramadan are actually having a worse renal function compared to those who did fast during the month of Ramadan. And this was statistically significant. If you can see, the p-value is 0.002. If you look at the creatinine post-Ramadan, the creatinine again in the non-fasting group is higher than the fasting group. And if you look at it longitudinally, you compare those non-fasting before and after Ramadan, in the non-fasting group, the creatinine has actually worsened. I can't find a good explanation for worsening of creatinine in someone who's not really fasting. While in the fasting group, the creatinine has improved from 1.5 to 1.42, and that was statistically significant. If we look at the eGFR in the two groups, the eGFR in the non-fasting group has declined, while it has improved a bit in patients with who did fast during the month of Ramadan. So the conclusion of the authors was that fasting for patients with stage 3 and 4 is well tolerated, and they have recommended that patients with stage 3 and 4 can fast safely during the month of Ramadan. Now, this study looked at patients with diabetes and chronic kidney disease. The other issue with this trial is that it did not look at diabetes outcomes. It just looked at the creatinine in those patients. There are two trials that has looked at the diabetes outcomes. One of them was conducted in our hospital, and this was done in published in 2019, where we used the Libre sensor in patients with chronic kidney disease, and we tried to look at the frequency of hypoglycemic events in those patients. And if you look at the data from the Libre sensor, I have put this red rectangle in the top table, where it shows the number of hypoglycemic events. The number of hypoglycemic events in the same patient, before Ramadan and after Ramadan has doubled from 2.3 to 4.4 episodes as a mean of hypoglycemic events. Not only that, the duration of hypoglycemia as measured by the freestyle Libre was around 45.9 minutes. These 2.3 events, it has increased actually to more than double. It reached 1.1.9 minutes as the mean duration of hypoglycemia. So what I would say in a patient with chronic kidney disease, and in this trial, we included only patients with stage 3 chronic kidney disease who are stable, who opted to fast during the month of Ramadan. And we used the Libre sensor. So the number of hypoglycemic events has actually doubled, and the duration of hypoglycemic events has actually doubled. What we noticed in these hypoglycemic events, they were basically mild hypoglycemic events, that did not require hospital admission. When we looked at renal outcomes, specifically at the creatinine and the urea and the urinary albumin creatinine ratio, this did not change before or during and after Ramadan. So with regard to patients with chronic kidney disease stage 3, fasting during the month of Ramadan, we would conclude that is associated with an increased frequency and duration of hypoglycemic events, but there is minimal changes in renal function, and probably renal function remains stable. The other trial was done by the group of Dr. Tahseen Chaudhary in London, and they looked again at patients with stage 3 chronic kidney disease. It was observational trial. They compared patients who did fast during Ramadan to those who opted not to fast during the month of Ramadan. And in this trial, if you can see, the number of hypoglycemic events is almost again double or 1.5 times that of those who did not fast during the month of Ramadan. The mean hypoglycemic events was around 5.6 in the non-fasting group compared to 8.3% in the fasting group. The authors did comment that actually the hypoglycemic events were mostly in patients who are on insulin and sulfonylureas. There were no admissions to hospital with severe hypoglycemia. There were no admissions with any adverse events or acute kidney injury. So again, this is another study that proves patients with stage 3 chronic kidney disease are actually at higher risk of hypoglycemia if they opted to fast during the month of Ramadan. Now, these were the published data until now. I would like to share with you one important study that has not yet been published, and this is the data from the Dar Global Survey. The Dar Global Survey is a survey that was conducted in the year 2020, where during the pandemic of COVID, and the idea was to see whether the pandemic has affected the decision to fast or not. The survey included a huge number of patients, more than 6,000 patients, and they have defined in this survey, it included all patients, and here I'm going to focus in the group of patients with nephropathy or chronic kidney disease, and I'd like to put specific comments here before I show you the results. The first comment is that chronic kidney disease or nephropathy has been defined not as just deterioration in kidney disease, but it has been defined as any patient with element of nephropathy. Even patients with microalbuminuria has been defined as chronic kidney disease, and they have been included in the analysis of patients with chronic kidney disease. Hyperglycemia in this survey has been defined as a blood glucose more than 300, and hypoglycemia as a blood glucose of less than 70. Now, if we look at the data in the survey, in the total number of patients, the 6,700 patients, the number of males and females was actually similar in the group of chronic kidney disease compared to the non-chronic kidney disease. If we look at duration of diabetes, the duration of diabetes was higher in patients with chronic kidney disease. If you look at the second bars on the right side, where you look at the duration of diabetes less than 10 years or more than 20 years, patients with the light green is the patients with no chronic kidney disease. So they're mostly patients who don't have chronic kidney disease are mostly the patients with the light green were around 53%, and they were having a duration of diabetes of less than 10 years. While if you look down at more than 20 years, they're mostly from the CKD group, and they represent around 33.6% of this group of more than 20. If we focus specifically on patients with diabetes and chronic kidney disease, we would see that the total number of those patients is around 707. So it's a good number because all the trials, as I said previously, we include around 20 to 60 patients. So we have around 707 patients with diabetes and chronic kidney disease. The mean duration of diabetes in type 1, those we divided them CKD type 1, CKD type 2. Type 1 was around 16.6 years, while those with type 2 was 15.2 years. The mean duration of the mean A1C was around 8 in both groups. Now, when we come to the most important things related to this presentation, which is the risk of fasting during the month of Ramadan in this group of patients. And if you look at the question that says, did you have any daytime hypoglycemia during the month of Ramadan? The percentage was around percentage of patients who said yes. Out of 5,440, around 23.1%, they said yes, they did have hypoglycemia. And those are patients who do not have chronic kidney disease. If we look at patients who had CKD, who developed hypoglycemia during Ramadan, the number is 153, and around 30% of them actually said they had hypoglycemia. So, and you can see the difference. It's almost 1.5 times that that was seen in patients with no chronic kidney disease. The second question was, did you break your fast because of diabetes-related illness, which is hypo or hyperglycemia? 20% of those without chronic kidney disease, they said they did break their fast, while almost 30% in the CKD group, they said, yes, they did fast. They did break their fast during the month of Ramadan. So this is, again, a higher percentage of patients in the chronic kidney disease group. Now, if we look at the hospital admissions, and this is very interesting because we have not seen this in any of the previous trials. If you look at admissions due to hypoglycemia, and patients who are asked specifically, have you been admitted to emergency or the hospital? If you look at patients with chronic kidney disease, which is the blue bars, it says around 9.8% of them, they got admitted to emergency because of hypoglycemia. That's 10%. It has not been reported in any previous trial, hospital admissions because of hypoglycemia. Again, patients admitted to the hospital, so in hospital admission was around 2% in people with chronic kidney disease compared to 1% in the non-CKD group. And I'd like to remind you, the non-CKD are not purely diabetes without complications. They are diabetes with other complications, which could be cardiovascular disease, which could be any other complication of diabetes. So the admissions in CKD group is much higher than the other group. And if I will put them together, the total admissions to emergency and ER in chronic kidney disease is almost 12%. So almost 12% of patients with CKD has been admitted to hospital. If we look at the hyperglycemia admissions, it's almost the same, 6.4% in the no CKD compared to around, again, 11%. So in total, the number of patients admitted to hospital is almost 24% during the month of Ramadan. So it does make sense to me. I'm not going to take more than 2 extra minutes. It does make sense that putting patients with a stage 3B as moderate risk, because an EGFR between 30 to 45 put you in a moderate risk. Putting in mind that those patients might be on insulin or might have any other risk factors that will push their risk to from moderate to high risk, and the advice of telling patients not to fast during the month of Ramadan would probably be very accurate and accurate advice. And I think with this new 2 trials or 3 trials and this survey, we still will need to carry on with the current recommendations that says patients with stage 3 and for chronic kidney disease are still at high risk and should be advised against fasting. And if they insisted to fast against medical advice, specific measures to help them fast safely during the month of Ramadan should be provided by using a CGM or using a frequent SMBG and frequent advices and teleconsults. And this was my last slide. I'd like to thank you very much. This is just a summary. I forgot. The summary says here, is it safe for those people to fast during the month of Ramadan? From the studies, we say, yes, they can fast safely. Does it affect the kidney function? No, we didn't see any much of changes in kidney function in those people. And if at all, it will improve. However, it is associated with an increased risk of hypoglycemia, hospital admission, and emergency admission. We definitely need larger controlled multi-center trials to assess again the renal outcomes and glycemic outcomes in this group of patients. Thank you very much for listening.